Today, we'll be looking at postpartum and parenting under the NCLEX needs, client needs category of health promotion and maintenance. So what are the major assessments we need to look out for in the postpartum period? Remember, there's a fourth stage of labor. So we need to assess our clients, especially in the first 1 to 2 hours. So we need to assess the client's vital signs, blood pressure, pulse. Every 15 minutes, we need to assess the vital signs every 15 minutes in the first 1 to 2 hours. And we need to follow our hospital policy or protocol until the client is stable. Again, we also need to assess the fundus and the fundal heights every 15 minutes within the first 1 to 2 hours. You're looking at the position. So it should be at the level of the umbilicus for the first 12 hours. Then it should descend by 1 finger breadth each succeeding day. And by the 10th day, it should be a pelvic organ. So you can see this is 2 days postpartum, 4 days postpartum, 6 days postpartum, and by the 10th week, the 10th day, it should be a pelvic organ. We also need to measure the urinary output, put a keen eye on assessing the client's urinary system. You want to measure her first void because the client might have urethral edema or urine retention. So you want to monitor that in the first 1 to 2 hours. Again, you also want to assess bonding. So you want to encourage interaction, emphasize touch, eye contact with the newborn. So those are what you're looking at in the first 1 to 2 hours. We're also assessing for lochia. You're looking out for color. You're looking out for the volume of lochia every 15 minutes. So remember, lochia is that endometrial sloughing and all of that. So in the first day, between day 1 to 3, we should be expecting lochia rubra. So that will be a lochia rubra. It's usually bloody with a fleshy odor, and there might be clots, like you can see in the pictures. There could be clots. So that's the first between day 1 and 3. Between day 4 and day 9, we should be looking out for lochia serosa. So it could either be pink or it could be brown with the same fleshy odor. And from day 10 onwards, we should be looking out for lochia alba, which is usually yellow to white. And at no time should there be a foul odor. If there's any foul odor with the lochia, then you should start suspecting infection. In terms of your plan, we want to give Rho-D immune globulin, your IgIM, to the mother if it's been ordered. Remember, Rho-D promotes lysis of fetal ROH positive red blood cells that are already circulating the maternal bloodstream. So you want to give this Rho-D so that it will help to break down these fetal ROH positive red blood cells in the mother's bloodstream before ROH negative mother. If the mother is ROH negative, you want to give this medication before she develops her own antibodies to the fetal ROH positive RBCs that are already circulating in her bloodstream. You also want to assess lochia color and volume. You want to check episiotomy if there was any, and also you want to check the peritoneum or the perineum, sorry, for signs and symptoms of infection. You also want to assess for attachment and bonding between the mother and the child. Remember, this is usually influenced by maternal, psychosocial, and cultural factors. It's also influenced by the infant's health status, circumstances of the prenatal, intrapartal, or postnatal, or even the neonatal cause. And you would notice there will be good, you can say there's good bonding or attachment. It's usually evidenced by touching and cuddling, or even naming the baby, or and face positioning for direct eye contact. And later, you would notice this by reciprocity and rhythmicity in the maternal and infant interaction. You also want to promote successful feeding for non-nursing mothers who might need to suppress lactation. And we can use mechanical methods to suppress lactation by using a tight-fitting bra for at least 72 hours. We could use ice packs, And again, you want to minimize breast stimulation if the mother is not if she's not nursing. For a nursing mother, successful lactation is dependent on the infant sucking and also maternal production and delivery of milk. Okay, so you want to monitor and teach preventive measures for potential problems if the mother is going to breastfeed. So in terms of lactation, you want to teach the clients to avoid soap on the nipples, because this would help to prevent dryness of the nipples. Again, she needs to look out for redness or swelling, which can indicate infection. If there's any, it should be investigated. In terms of initiating breastfeeding, especially if it's a new mother, you want to have her in a relaxed position. This is very essential. And again, you want her to support the dependent arm with a pillow. She also needs to be taught to alternate which breast is offered first. So in every breastfeeding session, if she starts with the right, then in the next session, she wants to start with the left. So she wants to alternate the breast that's offered first. Again, you want to go at least up to 5 minutes on each breast at first. And then you also want to teach her the proper way to break suction. Again, most of the areola, the major part of the areola should be in the infant's mouth to also ensure proper sucking. So again, like we said, in terms of nipple care, you're also looking out for potential problems like nipple irritation and cracking. That's a potential problem for mothers who are breastfeeding. So in terms of nipple care, you want her to clean the breast with warm water, no soap. She could use absorbent breast pads if leaking occurs. She can apply warm compresses after each feeding and also air dry. She also wants to position the nipple so that the infant's mouth covers a large portion of the areola, like already discussed. And again, if she wants to release the infant's mouth from the nipple, she should insert a finger to break the suction. And again, she needs to rotate breastfeeding positions. Engorgement is another potential problem. You can see in the picture, this is what the normal lactating breast looks like. It's soft and the mom is comfortable. But here you can see the breast is engorged, it's full, it's hard, it's also sore. And this pressure can cause damage to the cells. So like we said, engorgement is another problem. So you need to teach the mother to nurse frequently, at least every 30 minutes to 3 hours, and long enough to empty the breast completely. So how do you know the breasts are emptied completely? You would notice the infant to be sucking and the infant is not swallowing. Then you know that side of the breast has been emptied. Again, you want to encourage warm shower or compress to stimulate the let down reflex of milk. You also want to alternate starting breast at each feeding. We also want to give mild analgesics 20 minutes before feeding and ice packs between feedings for pronounced discomfort. Again, plugged ducts is another potential problem. You will notice there will be areas of tenderness and lumpiness that's often associated with engorgement. This may be relieved by heat and massage before feeding. In terms of expression of breast milk could be expressed and collected for supplemental feeding. It could also be expressed to relieve breast fullness or to build milk supply. It may be manually expressed or pumped by a device and refrigerated for no more than 48 hours. It could also be frozen in plastic bottles. You know, when you freeze it, it tends to maintain stability of all the elements in the breast milk. So it could be frozen in plastic bottles in refrigerator freezer for 2 weeks. You can also do that in a deep freezer for 2 months. Again, when you want to thaw the milk, you don't want to thaw it in a microwave or on stove. Again, you also should be careful with medications because most drugs cross into the breast milk. So you want to check with the healthcare provider before taking any medication. Again, postpartum blues could be another complication. This usually happens between day 3 to day 7. It's a normal occurrence with you notice roller coaster emotions. You could notice the client is weeping or that let down feeling. These feelings are usually relieved with emotional support and rest, even sleep. Or again, you want to report if it's prolonged or it occurs later than the 3 to 7 days period that it would have been expected. In terms of urinary incontinence, you want to teach Kegel exercises. So you want the client to tighten the pubococcygeal muscles. So you want them to tighten the pelvic floor muscles and hold for a count of 3. Then you want them to relax the muscles, and they can do this 10 times, 3 times a day. You also want to teach them to avoid diuretics such as caffeine. In terms of sexual activity, you will encourage the client to abstain from intercourse until the episiotomy wound is healed and lochia has ceased. This could take between 3 to 4 weeks. Again, sexual activities may be affected by fatigue, fear of discomfort, leakage of breast milk, concern about another pregnancy. So you want to assess and discuss the couple's desire for and their understanding about contraceptive methods. Remember, breastfeeding does not give adequate protection, so oral contraceptives should not be used during breastfeeding also. So you need to teach them to avoid using oral contraceptives, especially if the mother is breastfeeding. In terms of parenting, you want to assess the couples if they have good knowledge of growth and development. What's their family composition and family dynamics like? What are the cultural influences that may affect their ability to parent this child? You're looking out for resources available to these parents, financial resources, even support mechanisms, and how they are able to get support from relations and all of that. You also want to assess for previous experiences they've had in terms of pregnancy. You also want to assess what the age of the parents are so that you're able to forecast what potential problems that could arise. Again, you are trying to assess their interpersonal relationships and attachments, also communication between parents and even with the child. What are the expectations of these parents? What are the motivations? What commitments do they have? So those are what you want to be assessing with parenting. And in terms of your plan, again, you want to know your nursing diagnosis as related to parenting. There's a risk for impaired parenting. Is there a readiness for enhanced knowledge, readiness for enhanced family processes? So in terms of your plan, you want to promote realistic age-appropriate expectation. So for infants, they need to know what the growth and development stages are. So you want to guide them on what they should expect in terms of realism. So in terms of social interaction, motor, and language for the child, they need to know what is expected at what certain period. Again, you want to provide anticipatory guidance, educate regarding routine health care, observe for responses to stress in these parents, and again, encourage active participation in caring for the child, and you want to support the clients as needed.